Welcome to our recording for Anatomy and Physiology 2, the second half of Anatomy and Physiology. Here we are talking about the lymphatic system, and we're going to discuss some of the course notes that we have for the course. As always, to obtain a better, more in-depth understanding, it's a good idea to read more in depth into the textbook as we go over the highlights and summaries of the lymphatic system here in this recording. This lymphatic system is going to replace leaked fluid and proteins from that blood vascular system. So last section we talked about the cardiovascular system, the vessels, and how it brings fluid to tissues. Here we see how this lymphatic system can drain some of those fluids, and also it plays an important role in immunity. So we're going to talk about this vessel system, some important cells and tissues, and generally some important lymphoid organs. It is noteworthy that this lymphatic system works hand in hand with the immune system. Later on, we talk about the immune system in this course. We see how much of this immune activity is going to occur inside these lymphatic structures that we discuss today. So when we say lymphatic system, that's going to be the organs, the vessels, and the fluid called lymph. So lymph is going to be similar to an interstitial fluid. And just as a general overview, in the lymphatic system, we're going to talk about things like lymph nodes, spleen, thymus, tonsils, and MALT, meaning mucosa-associated lymphatic tissue. So this lymph is going to originate as interstitial fluid, and it moves passively due to a pressure gradient in the lymphatic capillaries. In other words, roughly about 3 liters a day of lymph gets processed through this system. And so this stuff that we call lymph is interstitial fluid, and that's mostly water. We're going to have some dissolved solutes and proteins as well. In this diagram, we see lymphatic structures highlighted, such as red bone marrow, the spleen, the thymus, and notice that these green sort of blood vessel looking things are actually lymphatic capillaries, and perhaps you can see how those lymphatic capillaries are interspersed with lymph nodes. So having said that overview of the lymphatic system, let's go into some functions of that lymphatic system. One of those is going to be drainage. So we're going to drain the interstitial fluid that resides between the cells in the tissues. Another thing that we might do is going to have lipid transfer. We're going to transfer lipids, and then we're also going to transport this lymph fluid from one lymph node to another lymph node. And then in result, we're going to return this excess interstitial fluid back into the bloodstream. And then a third function in terms of facilitating an immune response, we're going to fight infection this way. We're going to sort of attack foreign invaders, specifically a lot of bacteria, and we can engulf these bacteria through phagocytosis. Let's go in depth into some of these lymphatic vessels and how that lymph gets circulated around. And the image in the upper left, we have a review of the cardiovascular system. Let's start clockwise at the heart. And we know that the heart now pumps that blood throughout the systemic circuit. And then we bring that blood, which contains plasma, to the tissues. And some of that fluid leaks out through those capillaries. Then recall that these blood capillaries then return to veins, and then the venous system brings it back to the heart. But let's go back to capillaries. We talked that some fluids leak out at the capillaries, and so this interstitial fluid needs to be collected once again. So in this diagram, we see how interstitial fluid moves along the capillaries into things like nodes and then trunks, and then ducts. And then we jump back into the venous system for another round through with the heart. So these lymphatic vessels actually begin as lymphatic capillaries shown in this diagram on the upper right. And then, as discussed before, the interstitial fluid drains into lymphatic capillaries. Thus, we form a substance called lymph. Let's take a closer look at that lymphatic capillary. That's what we're talking about when they say they're blind-ended tubes. In other words, the circulatory system, the cardiovascular system, talked about blood vessels being sort of open-ended, a one-way tube. We want most of that fluid to stay within that system. These lymphatic vessels are unique that they are highly permeable. So why would we want would we want a permeable vessel, a permeable lymphatic capillary? One is their permeability allows fluid to enter the lymphatic capillary. So in this diagram above, we see sort of flap-like mini valves that allow fluid to enter. Secondly, large particles like cell debris, things like large proteins and pathogens may indeed pass into the capillary, but are then trapped into a one-way direction system. And that one-way direction system is going to bring those foreign invaders into the lymph nodes where they get processed. So a good example of a lymphatic vessel is a lacteal in the small intestines. So these lymph vessels lack a basement membrane, which is noteworthy. Many of those cardiovascular vessels did have a membrane basement. And so these lymphatic capillaries get held into place. Perhaps in the above diagram you can see how we have anchoring filaments, and those are going to lock those capillaries into place, while the one-way flaps allow for fluid entry. But again, fluid can enter, but it prevents the loss of that fluid. When we get a rise in interstitial hydrostatic pressure, that's because of the filtering of blood from the capillaries. That's going to cause endothelial cells of the lymphatic capillaries to sort of push that interstitial fluid into the lumen of those lymphatic capillaries. And as mentioned before, pressure by these lymphatic forces makes sure the closure of those endothelial cells, resulting in that trapment of that lymph inside those lymphatic vessels. So then after the lymphatic capillaries, this fluid then moves into lymphatic vessels, which drains into lymphatic trunks, and then we move into lymphatic ducts. So in other words, the lymph is flowing into increasingly larger vessels, larger lumen diameters, so to speak. Just like the cardiovascular system's veins had valves installed to prevent the backflow of blood, so does the lymphatic system. So these valves are contained within the lumen, and that's going to prevent lymph from pooling, that is P-O-O-L-I-N-G, pooling within vessels. And also we want to prevent backflow of lymph because this system is under low pressure. This is especially crucial in the lower limbs where this interstitial fluid is indeed under lower pressure. Later on, we talk about how we might also get this lymphatics returned back to the heart. Things like skeletal muscle, the pulsative movement of arterial blood, and rhythmic contraction of smooth muscle can all help, quote-unquote, milk that lymph back towards the heart. And then as this lymph moves back towards the heart, lymphatic organs, or sometimes most of the time, lymphatic nodes, are going to filter foreign or pathogenic material from the lymph as it passes from one structure to another. On this slide, we get a little bit more in-depth view of some of these trunks and ducts. So we see that we have these things called lymphatic trunks, and these are going to be some of our larger vessel lymphatics. And these are going to be on both the right and left sides of the body, and these are going to bring that filtered lymph from certain specific body regions. So we have a right lymphatic duct on patient's right side, and then we have a thoracic duct on patient's left side. This right lymphatic duct is going to drain lymph from the upper right side of the body, and the left lymphatic duct drains lymph from the rest of the body. Perhaps we can see that, well, let's go back to the other one to get a good view of this, that our right lymphatic duct is going to drain into the junction of right subclavian vein and right jugular vein, whereas the thoracic trunk is going to flow into the confluence of left subclavian vein and left jugular vein. There's a special feature in this lymphatic system called the cisterna chyle. The cisterna chyle receives chyle, and this chyle is going to be a lipid-rich lymph from the small intestine. And then we're also going to be receiving some lymph from the left and right intestinal and lumbar trunks. So we can see that this large green blob, so to speak, sort of acts as a cistern, a sort of catching place for lymph. And that lymph, again, is going to be lipid-rich because we're draining materials from the abdomen. Here's another view of that cisterna chyle. Let's talk about lymph transport now. How does this lymph get pumped around? Well, again, as we mentioned before, it relies upon the pressure gradient within that tissue. But how do we get that lymphatic back around? Let's take a closer look at that. So in this diagram, we see again how the lymphatic system works alongside with the cardiovascular system. Now we get a little bit closer to looking at that venous return. So we're looking at the light blue region here. And it's interestingly the same mechanisms that control venous return. In other words, milking of skeletal muscle, things like valves are going to help promote return of that fluid. So whereas this lymphatic system has a very important job of keeping the body's immune system up and running, as with any system in the human body, there are going to be homeostatic imbalances. Buboes, take for example bubonic plague, is an example of a homeostatic imbalance within the lymphatic system. Lymphatic blockage, sometimes there is debris that blocks up that passageway, and we get pooling of lymph. Lymphedema, splenectomy, lymphoma, and tonsillectomy, those are all homeostatic imbalances of the lymphatic system. We're going to talk a little bit more about those down the road in this lecture. Let's talk about some cells and some tissues of lymphoid organs. So when we say lymphoid organs, this could be occurring in the spleen. This could be occurring in Peyer's patches on the small intestines, or even something like lymph nodes, is where we're going to see a lot of these special cells. Lymphocytes, you might recall, are special cells, white blood cells, that are going to help eat or kill bacteria, so to speak. Plasma cells, macrophages, dendritic cells, and reticular cells. We're going to find these in the lymphatic system. And again, the main idea is to help fight foreign pathogens such as bacteria, virus, and fungi. So with the cells in mind and with the vessels we talked about earlier, we say how the lymphatic system is also going to be made up of special lymphatic tissue and then special lymphatic organs. Take, for example, red bone marrow. We might call red bone marrow a primary lymphatic structure, and as well as the thymus. We might call those primary lymphatic structures because they are in charge of the formation and maturation of lymphocytes. Then when we talk about things like secondary lymphatic structures, we're talking about structures composed of lymphatic cells within the reticular extracellular connective tissue. That's what we mean by the loose connective tissue there, the CT. Things like lymph nodes, spleen, tonsils, MALT, etc. We're going to be calling those secondary lymphatic structures, and each of those are going to serve as a sort of housing structure for lymphocytes and important immune cells to do their job, such as an immune response. So these secondary lymphatic structures are sometimes referred to as lymphatic organs, or aka lymphatic nodules. And we're going to differentiate these by the presence or absence of dense irregular connective tissue capsules. These complete capsules exist in the lymph node and the spleen. Incomplete or absent capsules exist in tonsils, MALT, and lymphatic nodules. So perhaps in the histology on the right side, you can note the presence of these nodules, so to speak. Let's now turn our attention to lymph nodes. These are a primary organ of the lymphatic system. We call these sort of bean-shaped, so to speak, up to about 1 inch long. And from a diagram, we can see that these are located along the lymphatic vessels. Their function is for filtration. They contain macrophages that help destroy any type of cellular or foreign pathogenic debris. Also, we're going to have an immune system activation. Here in these lymph nodes, we can mount an attack against any foreign antigens. The structure of these lymph nodes, we have a capsule, trabecula, and stroma. Here we have a good image showing this lymph node. It is noteworthy to see how lymph flows. So notice with the arrows that we have lymph flowing in here. Coming into the lymph node is 1, 2, 3, 4, 5 entrances, and then this is just an example. But notice how there are 2 exits. So the idea with 5 entrances into this lymph node and 2 lymph node exits out of it, that creates a sort of ratio, a sort of backup, so to speak, a sort of quote-unquote traffic jam, you might call it, and therefore lymph that flows through this nodal system is sort of forced to stay in there and reside in there and become subject to these germinal centers. And these germinal centers are where we're going to have phagocytosis of the foreign invaders. So as we said earlier, these lymph nodes are going to filter the lymph and get out any unwanted substances. In terms of gross anatomy, the location in the body, we're going to have a lot of axillary lymph nodes in the armpit region. We're going to have a pretty dense cluster in the inguinal region. In other words, we're going to have a lot of cluster of nodes in the groin. And then also we seem to have a concentration in the cervical region, and that's going to receive lymph from the head and the neck region. In the parenchyma of these lymph nodes, we have it divided into 2 main regions, a cortex and a medulla. In the cortex, we have lymphatic nodules comprised of reticular fibers that support the inner germinal center. And that inner germinal center is going to be a housing structure for both B lymphocytes and also macrophages. And then we have an outer region called the mantle zone. That's going to contain T lymphocytes, macrophages, and dendritic cells. Then in the medulla, we contain supportive connective tissue called medullary cords, and also strands of B lymphocytes, T lymphocytes, and macrophages. This cortex and the medulla both contain lymphatic sinuses that are going to help pool and collect that lymph. So as we mentioned earlier, we want lymph flowing in a one-way direction. And so the idea is that the lymph enters these sinuses where macrophages assist in the removal of foreign debris. And then sometimes we might get a sort of homeostatic imbalance with these. We get swollen or tender lymph nodes. That's going to indicate an infection, and that's also a sign that the lymphocytes are proliferating to combat the infection. So quite often you'll notice a medical professional might palpate certain regions where we have lymphatic nodes clustered, and if they feel some swelling, that's the possible indication of infection occurring somewhere in that region. Let's take a break for a second and talk about a homeostatic imbalance, metastasis in this lymphatic system. So again, although these lymphatic vessels provide an essential service by routing that excess interstitial fluid back into the blood vessels, well, unfortunately, they can also transport pathogens or disease. And so one example of this disease transport is the transporting of cancerous cells, and this is what we're talking about when we say metastasis. Generally speaking, these cancerous cells break away from the primary tumor, and then they travel to other sites. That might possibly set the stage for another tumor formation where it ends up at, and the new site is going to be called the secondary tumor site. We might be able to palpate these cancerous lymph nodes. They're going to be firm, enlarged, and not tender, which contrasts with the infected lymph nodes, which are not firm. As you might recall, they are rather tender. So we've talked about lymph nodes, and now let's talk about some other lymphatic organs. In this diagram, we see that tonsils consist of lymphatic tissue. The thymus, the spleen are also consist of lymphatic tissue. And then in the small intestines, we have patches of lymph, and that's going to be around the intestines to help fight any bacteria that might be in the food. And then lastly, the appendix also consists of lymphatic tissue. So let's take a look at this organ called the spleen. This spleen is going to be our largest lymphatic organ. It's roughly about 5 inches long, and it's generally located between the stomach and the diaphragm. We can see that it lacks a cortex and medulla, and instead it has a sort of encapsulated form. So this capsule is going to be connective tissue, and the connective tissue then has trabeculae, which extend into the organ. Once we take a transverse view and make a cut of the spleen, we might see different colors in there. We might see red pulp and white pulp in the parenchyma. The white pulp of the spleen consists of T lymphocyte, B lymphocyte, and macrophage clusters. The red pulp of the spleen consists of erythrocytes, platelets, macrophages, and B lymphocytes. And these are going to be housed within reticular structures called splenic cords. We're also going to have permeable capillaries of the red pulp, and that's going to have connective tissue that allows for easy entry and exit of blood cells across the vessel wall. And then in addition, that red pulp of the spleen serves as a sort of platelet reservoir, and that's going to house approximately 30% of the body's platelets. So another function of this spleen is to filter blood and also store the blood. Blood enters the spleen through the central arteries, flowing up through the white pulp, where it first monitors the foreign debris, and next it goes into the sinusoids of the red pulp. That's where the macrophages are going to be lining the sinusoid. That's going to phagocyze the foreign debris. Let's talk about a homeostatic imbalance, a splenectomy. A splenectomy is going to be the surgical removal of this spleen. And this procedure is performed for several reasons. One of those including a splenic infection. So if the spleen becomes infected and possibly too busy, too effective at doing its job. Another reason we might have to remove a spleen is going to be a cyst or tumors that develop within the spleen. Other diseases such as Hodgkin's lymphoma or other types of cancer or blood disorders might be a reason to remove it. And lastly, a splenic rupture is a reason to remove it as well. The spleen is at an unfortunate location where it is subject to external contusions from the external environment. It may seem that we might not be able to function without a spleen, but often we can do okay without a spleen. If the spleen is removed, other lymphatic organs may take over many of the spleen's duties and functions. And that's a common thread through the lymphatic system. Thymus is a good example. For example, the thymus is very active and prevalent as an infant, but in our senior ages it shrivels up and becomes rather non-effective. So backing up a bit, we talked about how red bone marrow actually has some lymphatic functions. That red bone marrow is going to be in spaces between the trabecula and other select portions of the spongy bone. Recall that we're getting hemopoiesis occurring, the formation of formed elements. So T lymphocytes, also called T cells, are going to be formed from the red bone marrow, and then they're going to migrate into the thymus to complete that maturing, that maturation process. So here on the looker's right, we see an image of the thymus located immediately behind the sternum. The thymus, I should say at its prime, consists of two fixed lobes called thymic lobes, and eventually they are subdivided into trabecula, into lobules. These lobules are composed of epithelial tissue infiltrated with T lymphocytes in varying stages of maturation. This organ does have a cortex region to it and a medulla region. Here we observe some histology images of the thymus. Notice on the upper right we see a histology of the thymus showing that outer capsule, that is connective tissue that holds it in. And this does have a cortex region to it and then a medulla region. Inside this medulla is going to be thymic corpuscles, also called Hassel's corpuscles. This medulla is going to contain mature T lymphocytes, whereas the cortex is going to contain immature T lymphocytes, also called pre-T lymphocytes. And one of the unique things that differentiates this lymphatic organ from other lymphatic organs is the fact that we call it a lymphoepithelial organ. It contains both lymphatic cells and epithelial tissues, and that is going to be shown on the lower right-hand diagram. Another secondary lymphatic tissue is going to be tonsils. And here on this diagram we see the location of tonsils in the pharynx region and the back of the throat. So in other words, they sort of form a quote-unquote ring at the top of the throat. These things called pharyngeal tonsils might more commonly be called adenoids. Those are going to be in the posterior wall of the nasopharynx. We have palatine tonsils, lingual tonsils, and something not shown here is tubal tonsils around the auditory tubes. Again, these tonsils are secondary lymphatic structures. These guys are not completely surrounded by a connective tissue capsule. What we see here are the germinal centers in this histology image, and also we see the follicles. One unique feature about these tonsils is seen in this histology image. We see tonsillar crypts, and a crypt is a sort of cavity, so to speak, in that tissue. And notice how this tonsillar crypt sort of allows more surface area for the tonsil. And if we have more surface area, then we have a better chance of trapping any sort of foreign invaders. These tonsils are designed to protect the pharynx from infections, but they themselves sometimes become infected. They might get infected like things like viruses or bacteria. And sometimes the swelling goes away, but other times we get permanent or recurrent infections, and we might call this chronic tonsillitis. If medicines or medical treatment does not help chronic tonsillitis, surgical removal of the tonsils may be performed in what's called a tonsillectomy. Lastly, we have general lymphatic aggregates. These are going to be concentrations of lymphatic tissues not surrounded by a capsule, and these are going to be scattered throughout connective tissue of mucous membranes. One such lymphatic aggregate is MALT, that is mucosa-associated lymphoid tissue, and this is going to be located in the lamina propria of the mucosa layer within the gastrointestinal tract. We'll also find this MALT in respiratory tracts, genital tracts, and also urinary tracts. But primarily we're going to find this MALT in the small intestine to defend against foreign substances that come in contact with the mucosal membranes. So we're going to call these Peyer's patches. These Peyer's patches are going to be collections of lymphatic nodules within the mucosa of the ileum. And they have the ability to become so enlarged, they sometimes actually bulge into the gut of the lumen. Lastly, the appendix is considered a general lymphatic aggregate. The function of the appendix is sort of multiple. We talk a little bit more about it in the digestive system. In the digestive system, we discuss how the appendix can act as a sort of refuge, a quote-unquote reservoir for natural bacteria that dwell within the gastrointestinal tract. That appendix also has MALT, some mucosa-associated lymphatic tissue to help fight against foreign invaders and pathogens. So that does it for the lymphatic system. Nice, straightforward, shorter system. Next time we jump into the immune system, where we go into a microscopic level and to see what's happening inside some of these lymphatic structures.